Welcome to Empowered Voices,
Yes.
Recovery to Resiliency. I'm Dr. Farzad Kamyar, joined by my co-host, Miss Amani Wilson. Hey. In this episode, we're exploring what we call the social determinants of health and how they shape experiences with substance use and recovery outcomes. Understanding these broader factors help illuminate the systems and contexts that affect both individuals and well-being in community health.
Yes, and today we are honored to have two guests on this conversation. First, we are joined by Miss Brittany Moore, an empowered program client whose recovery journey deeply involved addressing key social determinants, including housing, stability, and access to supportive services. This lovely young lady she chairs a meeting, Books Don't Lie, at Keeping It Real Ministries and then also you attend Keeping It Real Ministries as well. Mm. And at Keeping It Real Ministries, they go out in the community every fourth Sunday of the month and give back to the community, which is absolutely amazing. Yes. Also, we are deeply honored to welcome Dr. Joe Greer. He is the Dean of the Roseman University College of Medicine. Have my shirt on today.
Me too.
Right? We got to represent. But you are, though most people just call him Joe, Joe came from Roseman in 2020 with a vision to build a medical school that truly grows from the community it serves. The College of Medicine received preliminary accreditation for the LCME earlier this year and enrolled its first class of 64 medical students in July. Woo woo, right? Before coming to Las Vegas, he spent many years in Miami working directly with underserved communities. Underserved, sorry. They don't deserve that either. But underserved communities where he helped shape programs that train future doctors to see full picture of a person's health, not just what happens in the clinic. He led the nationally recognized NeighborhoodHELP program at FIU, which sends medical and health professional students into neighborhoods to learn from and support families over time. Along with his team at Roseman, they have created Genesis, a program providing household center care to Las Vegas while also educating medical students about the social determinants of health. His work has been recognized nationally, including receiving the Presidential Medal of Freedom from the President Barack Obama and a MacArthur Genius Fellowship. That is amazing, Dr. Joe Greer.
My mother said, even though I don't deserve it, don't return it.
That part, your mom's right. And then also, you wrote a book, Waking Up in America, about the realities of caring for people who are often overlooked, about shaping policy that listens to real lived experience. So we are incredibly grateful to have him with us today. We're incredibly grateful to have both of you guys today. Yeah. Thank you for coming.
Yeah.
Well, thank you for inviting us.
Yeah.
And it's a pleasure to be here with you, I'll tell you that much.
Thank you.
How many kids you got?
I have 5.
How many grands?
I'm 0, not yet. I'm not there.
I got one.
Amen. Well, let's get into this conversation. What exactly is social determinants of health, Dr. Farzad?
Yeah, great question, Amani, as I'm sure a lot of our listeners and viewers have that same exact question. But first, a little sort of plug. I just want to say thank you, Joe, you and your team, the leadership that you brought. For those of you that are unaware of what it takes to start a medical school in this country, the LCME accreditation process, specifically for what we call allopathic medical schools, MD degrees. And so I don't know if we would have been able to do it without Joe's leadership and the team. So thank you.
Thank you.
When we're talking about this subject of social determinants of health, what's the long story short? Joe was basically one of the pioneers of creating that concept in this country.
That's awesome.
Looking forward to jumping into that. Joe has enabled me to do what I do. And Brittany, having now known you and gotten to work with you, you are the reason, right, why I do what I do. So thank you again both for being here. Amazing opportunity for us. We're really lucky to have you.
Yes.
Let's get to it now.
Yes,
okay, here we go. What the heck is a social determinant of health? I'm going to hand it over to one of the individuals that had probably pioneered it in this country and knows it the best, Dr. Joe.
I get the title pioneer because my hair is white.
Oh, okay.
So I'm really old. So they assume I came out here in like a covered wagon,
Right.
which is not true.
So
We actually
silly.
took a plane before they shut down the government. Okay. I just wanted social determinants of health. Originally, this was called social determinants of inequality. And what we were looking at were what were the things in society that caused inequality? What caused person A to live longer than person B? Well, to put it as simply as possible, in the United States of America today, the most important code you have is not your genetic code. It is your zip code. Now, here's some statistics that will shock you because of social determinants. If you live in Mississippi, you do not live as long as somebody who lives in Bangladesh because of social determinants. If you are a Native American, you do not live as long as a Haitian in war-torn Haiti today. That tells you something.
It does.
There's a famous study, it's called the subway, and what it is it takes the subway from Manhattan to the Bronx. And every single mile, it shows you the decreasing longevity of an individual because of the poverty that they're living in. So what are social determinants? Social determinants are the non-biologic causes of biologic diseases. Diabetes. Why do we have an epidemic of diabetes in this country? It's not because everybody was born diabetic. Diet. Where you live. If you live in a high crime area, are you really going to send your kids out to go jogging at night?
Not at all.
Are you going to send them to the park if the park isn't being used?
Nope.
Because in studies, we also know that the parks, what makes a park important, and people will travel over 10 miles to, if parents get involved and volunteer in sports for their kids.
Yeah.
The parks where parents don't get involved become all this. So there was a gentleman called Sir Michael Marmont, British, out of Cambridge, who became the godfather, let us say, of social determinants of health. It is estimated that 70 to 90% of all diseases in America have a social determinant of health factor. That also goes into not just the cause of the disease, but the treatment. The government, and inappropriately so, wants us to teach more nutrition. Our response is yes. Are you going to build up SNAP so people can have the proper nutrition? Okay, so one thing is, teach us, please, and let us apply it.
Yes.
But the social aspects, which are not medical, which go towards disease, need to be taken care of. Living wages, transportation. When you live in areas like Las Vegas or in the southeastern United States where the humidity or the heat and dryness causes deaths, trust. Trust is a social determinant.
Yes.
Which is the reason why Roseman was out in the community for years before we got our accreditation. We had to build trust. We are not community engaged. We are community dependent.
Right.
And why do we teach the social determinants? Because it improves the lives of our patients. That's why we do every single thing we do. This is not ideological. This is science-based. We went into this profession to improve your quality of life. Let us learn so we can work together and get this done. And you got 5 kids?
Yeah.
I expect 4 of them to be in my medical school in 18 years.
Okay.
Now that baby will be.
Yeah, I mean,
In
look,
our medical school, excuse me, it's not mine.
I did not like that.
That's amazing.
nailed it straight on, hit the nail right on the head. Yeah. Think about, in my head, how I think about it is all the non-medical things you could possibly think of that affect.
Imagine this. You're struggling like hell to get to work. Okay? You just got your first job. Your car breaks down. Guess who's not calling Uber because they have no credit card?
No, honestly.
You know, guess who's not going to be waiting for the bus on the corner because there ain't no bus stop on that corner.
Right.
You know, so these are little things that we don't even think about. It's sort of like for Christmas for homeless children, everybody gives toys. Nobody gives socks and underwear, and they need that. And by the way, don't get new ones.
Right.
Yeah. So
Just a thought. What do you think?
I think you hit it on the nail with get new ones.
There you go.
with get new ones. Yeah. Okay, so we're in agreement on the get new ones. But yes, sort of continuing. Joe, you had mentioned this. So like where you live, so housing, employment and work, things like education. What does your social network look like? That talks about your community, your neighborhood, and then healthcare access. These are sort of 5 big subgroupings that we have that make up social determinants. And then you can start to fill in everything that you can think of. Things like Joe had mentioned, if you don't have transportation, if you don't have a credit card, if you don't have an ID, the list goes on and on. I'm going to call it almost infinite.
Yes.
And we've encountered that.
And as a nation, we have to look at policy from a national perspective, state and a local perspective. Because it was great that we got everybody insured during the Clinton years, but they had nowhere to go or a way to get there.
Yes. You know, I just want to say something. I realized my dad had mentioned this. We were on our way to church, and my dad had mentioned our church is off of Washington and like D Street, but where all the president names are in that area. And there is housing around there, but it's nothing but churches in that area, and there's housing. And there is not a Smith's, Albertsons. The only store that they have in that community is Mario's. Honestly, that is it. And I'm like, where's the food? And then
Or Dollar General.
yes, and what kind of healthy foods are you getting to help you live longer, really beat these diabetes?
There was a really interesting social experiment that was done in Pittsburgh where there were 2 African-American communities, both without a supermarket for 40 years. One of the communities actually got the second largest grocery store chain in Pennsylvania to open up a grocery store there. So what happened? 3 years later, people in that community were eating about 1,500 calories a day less and exercising. The supermarket was losing money. What happened? Something we didn't expect. People in the community had a sense of pride. They brought a grocery store to our community. They started influencing the local mom-pop shops. Guess what? They started selling the healthy food.
Okay.
So that way you didn't have to go to the grocery store because you knew if you went to store on X Street, they were your neighbor. You were helping them. And so all these different factors that are social determinants, the sense of pride.
Yes.
Yeah, that community.
The sense of I want to help my neighbor. All these different things that, with all due respect, the poorer the neighborhood, the more of a neighborhood it really is.
You are right.
Yeah.
I know our church does a lot of give back. Brittany's church does a lot of giving back in the communities.
Yeah.
But I mean,
Yeah. There's a lot of giving back that needs to happen in order
Yes.
to sort of undo a lot of the things that we're talking about. Specifically, Joe, when we're sort of this podcast, a lot of our focus is on these systemic things, but the sort of general undertone is substance use. Yeah, the world of substance use. Can you think of any ways in which these social determinants directly affect individuals with substance use?
Every single way possible you can imagine.
There it is.
Yeah.
There's no way that social determinants don't affect that. As a matter of fact, back in the early 90s, late 80s, I used to chair the Drug Policy Research Center at RAND, and one of the things we found, we didn't call them social determinants yet, but those that had these factors not addressed had the highest recidivism rate. Whether it was employment, family support, whatever it was at the time that we were looking at. How do you get a job if you can't take a shower before going for the interview?
honestly.
Wow.
or have clean clothes even.
Yeah.
Right.
Access to washer and dryers is important.
Yeah, totally. And this is one of the things that I really struggle with when it comes to being sort of an addiction medicine physician specialist is when you look at a lot of our, what we call it, treatments that we're recommending, not medication based. Okay, I'll leave the medications out of it, but a lot of that other stuff that makes up so much of recovery. Yeah. It's almost as if all of them are asking folks to change some social determinant of health. And I don't know how the heck they're supposed to do this. I'll give you
Exactly.
some common examples. You'll oftentimes find folks say, hey, so, you know, your friend group, your social network, the places that you used to go, on and
People,
on.
places,
Just,
and
you need to
things.
change it. So you need to not go there anymore. You need to stop hanging out with these people, right? And
But how?
Can you give me a list of new people
Right.
and new
Yeah.
places to go to?
Honestly,
Right.
and give me a ride to find these new people,
exactly.
and you know.
Yeah, yeah, and
Please.
so it's sort of in a way it's very soul crushing for me.
But the important lessons that you learn in that, now I'm going to put my educator hat on. Okay, why is Empowered in a medical school? Empowered is in a medical school because first and foremost, the founder, Andrea Peterson, is a graduate of Roseman,
Yes.
and this is the best place to house it. And she started this with Dignity Hospital in that system. So it's here for two reasons. Number one, it's an obligation we have as an academic institution receiving public dollars. We need to take care of the public. But as an educator, a student needs to learn the complexities of diseases. One of these diseases is called addiction or use disorder.
Substance use.
Substance use.
And then, so what are the complications and what goes into this? Now, very few medical students will come from families that don't have somebody.
Yeah.
That's that. But what do we do in society? We tend to hide it,
Cover it up.
cover it up.
It's
Like
a
a Band-Aid
stigma.
or something.
And then what do they need to learn as students? They need to learn the complexities. One of the things I learned that I didn't even know before this was you couldn't go to a food center unless you had a government-issued ID.
Yes, yes.
What?
Yes, a lot of food banks you had to have, or some of them you need proof of address. But if I'm homeless, where am I?
Yeah.
What's my address?
I had to show something too. I didn't.
You always have to show something. And if you want to get food for your babies, you have to show, a lot of them don't take crib cards. So you need your birth certificate, which you have to pay for.
Yeah, look, I fundamentally did not know any of this stuff. I am so new to this. I've only known about social determinants, I'm going to call it, for the past decade at best, right? Decade at best. But for me, it doesn't hit until I see it right in front of me in folks that I'm seeing and trying to navigate healthcare and being involved and empowered. Amani, you're hitting on so many different things that I was just learn what? Oh my gosh. Someone doesn't have an ID. They can't get X, Y, Z. I had no idea. And it impacts now me as a physician, what I'm doing on the white coat side of things.
honestly.
And you
Yes.
also have to realize that when we talk about policy change, I divide policy up into two things, health policy and policy that affects health.
Love it.
Those are two very different types of policies. Policies that affect health could be seatbelt regulation,
Okay.
okay, crosswalks, safety,
Yeah.
okay, nutrition, all those things. They're all there, but they affect health.
Yes.
Health affects your function on daily life. Daily life function affects society.
Yes.
Society affects family. All of a sudden, we understand the importance of these policies. And these policies aren't policies that should be driven by ideology. There are certain things that are right and wrong, but these should be driven by facts, by data, and by health outcomes and how well it helps society. And in particularly those at greatest need.
You're right.
And along those lines, I want to sort of take advantage of the wealth of information that you have, knowledge and experience. What can healthcare do? What can healthcare institutions? I'm talking the entire healthcare system, whether it's federal, whether it's state, whether it's local, like a medical school or a hospital or a physician's office, right, as an outpatient. Just what can we do? What's super high impact to support and address the social determinants?
Number one, local policies are the most important.
Yes.
Local.
It's
They
local
affect
policies
us.
are housing, local policies are transportation, and all these different things. So remember one thing: Get involved in your local
Yes.
issues. Forget this national stuff.
Mhm,
Take
'cause
care of
it
your
directly-
community.
Okay.
Yeah,
Right.
get in there. That's number one. Number two, who are we? We are individuals that took an oath to improve people's lives. That's what we did as physicians.
Mm-hmm.
That's what we do. Period. We're not here to become rich. We're not here to become powerful. But we are here where we see the consequences of whatever new drug, whatever new virus, whatever new disease falls at our doorstep. We have a moral and an ethical obligation that if we see something like that, we have to do something about it. Once again, empowered. Why is that important? Well, substance abuse is a big problem in our society.
It is.
We were ignoring the mothers with this whole issue because of Andrea, because of Farzad, because they put this whole program together and took it to where it is. All of a sudden, we can start addressing these things. But what does the student see? I can teach you addiction very theoretically. I can take you to an outpatient treatment or an inpatient treatment. But you know what? You don't see the fact that she has 5 kids.
You don't see
You
the
don't
story.
see the fact how much she's struggling to get a job, how much she's struggling to make sure her kids get the clothes they need,
Yep.
and especially the little itty bitty ones with diapers. And you know
And
what?
formula. It's
That's
not
right,
cheap.
formula.
It's
And
not
not only
cheap.
that, the clothes only fits for 2 months.
And honestly, and then they're up and out of it.
Now you got a
Right.
great library system here. You know that you can go to a library here and rent toys for your kids or check out toys.
I just found that out.
You can?
Yes,
Yep.
you can.
Well, thank you for telling me
You're
that.
welcome. And you go back and they sterilize them and use them for the next person.
You
I
can
like
get
that.
Wi-Fi at the library as well.
I use Empower to go and do all my schoolwork. Now, I utilize
She does. She
I
be pulling
utilize
shifts with me.
a lot of Empower right now for a lot of things because that's what you are there for us to do, to help me improve and better my future. So I go there to go get online and go do my schoolwork, my high school work, and even every time that I finish a test or anything like that, I get so much encouragement in the background. Yeah. Yeah. And it's not easy going back to high
Nobody said it
school.
was. No,
Man.
it wasn't easy when I was there. What the hell are you talking about? It's easy going back.
Right,
All
right.
these new concepts and
That's
everything.
right. And we didn't have that new math either.
Oh my
Right.
gosh.
Yeah, I mean, look, in my part of the world, I do, and I mentioned this a little bit, right, that I feel somewhat powerless when it comes to addressing the social determinants of health. I'm very fortunate to be involved with Empowered because I feel like, oh, well, here's something that I can do, and I'm now getting familiar with, and I can have that impact. What I really also additionally love is that, Joe, you've sort of embedded that into the DNA of our College of Medicine.
Yes.
So our students are making their way through this part of their career with the notion that there are things that are not in a textbook.
Yes.
I mean, anatomy textbook is amazing at teaching someone anatomy, pointing to the 10,000 different structures in the human body. Some rough estimate, yeah. And I can memorize the heck out of those, yeah. And one day I might go on to become the world's best orthopedic surgeon at replacing hips, let's call it, okay? I mean, my surgeries are flawless. People fly in from different countries. And then my patient, post-op day one, goes home and can't afford the medications, can't get physical therapy, is returning to no home.
Yep.
And lo and behold, this is what the evidence shows, there will be bad outcomes. That hip will have an issue.
If
And
not
it was
an
despite
infection.
my most amazing efforts. So the fact that we're sort of embedding this in the curriculum and folks are starting to see boots on the ground, that there are these things that affect our patients' lives more than anything else we do. This is groundbreaking.
I want
It
to let
is.
you know I was consulting at George Washington University about 8 or 9 years ago, changing their curriculum towards more of social determinants, and the chair of orthopedic surgery stood up and said, I get it.
I get
Because
it.
I did not become an orthopedic surgeon to amputate the legs of diabetics. That's
Yeah.
all we do now.
That's all we do.
Why? Because the social determinant
Yep.
causes diabetes. Diabetes is the number one cause of amputation. We were here to help in injuries, reform, and and all this stuff. So, you see the consequences.
You
that
do.
tumbles down.
Yeah, and from a systemic point of view, and I'll look at our little world,
Yeah.
right, which is empowered in Roseman, when we're able to affect these things, we absolutely see improvements in health and well-being. In our world, it's recovery, substance use.
It is.
It's sort of this safety net that allows physicians like me, because long story short, like I might write the prescription for something like, a medication to help with someone who's using fentanyl. And that's a life-saving medication, and it does amazing. But there's so much more to the story that goes into it. So when we have a program like this that folks can utilize to then start to hit on those other things, I get to see it. I get to see things like if the person is choosing to now be abstinent from fentanyl, they're able to be successful. If they're choosing to go back to school or go back to work, they're able to be successful. If they're choosing to work to get their child back because they've lost custody from Department of Family Services or CPS, whatever, and then that happens, I am seeing it every single day. And these are mega improvements. So we do see it directly affect recovery outcomes, health and well-being.
And imagine at that part in your career you're doing this. Imagine being a student and seeing this.
Yes, that's your foundation.
Yeah.
Wow, this is a reality. And guess what? You signed up for it. So let's go out and save the
Let's
world.
go. Superheroes.
But we'll start locally.
That's right.
We'll start. Look, Brittany. Look, most of this has been sort of high level. Okay, you ready?
I'm ready.
You ready? All right.
I'm ready.
We've talked about what are social determinants. How can we, as sort of policymakers and healthcare institutions and colleges of medicine, improve and sort of address social determinants? How the heck did all of these things that we've talked about impact you? You're someone with lived experience.
Okay.
Now we're hearing it straight from you. Whether it was housing, employment, some sort of social support, what did social determinants mean to you in your recovery or lack thereof? Right? Like, you can tell us about the pros, you can tell us about the cons, how things helped with recovery, how they didn't. Have at it.
Okay. Well, I'm going to start with treatment. Treatment was a Band-Aid for me. It was just getting my mind right and getting it focused, getting it back to the basics of living my life. And then I went to a shelter, and they put me right back into a neighborhood where I started to do everything that I can possibly think of.
Yep.
And it was really hard. I didn't have no direction. I had a little bit of security. What I mean by that is like they had a type of structure and I had to come in and have curfew, but they really didn't care. It is a lot of mess going on in that treatment. I mean, that shelter that I was in, and it's a 3-star. It was La Quinta, but it wasn't all that for me. And being there, I had to learn how to sit still and be patient. And by the grace of my higher power, I got to get into housing. And I didn't know how fast. I got in it so fast. Everybody keep asking me, like, how did I do it? I don't know. I sat down and I started living my life and started moving my feet a little bit more for my actions. I didn't talk anymore. I started doing better. And I finally got to do a house assessment, and I finally got my own apartment. And my first time walking into an apartment, you guys, because I've been out there in the streets since I was 13, I honestly thought I was in a bando. I was like, there's nothing in here. Oh, my God. What am I going to do? And then slowly but surely, the more I kept showing up for myself, I go to AA too. So I go to Keeping It Real Recovery Club, and I've been going there for about 4 or 5 months, and going there and learning the program and learning how to live my life the way that I have to live it now. And responsibility, I share chairs. I have commitments that I have to go to. Then and it's not I have to miss this day. I can't miss a day. I feel like if I miss a day, I'm missing a day of my recovery, and that's just how it is for me. And on the long way, I've been having my baby with me on the long way. So back to my apartment, I got all these things that I honestly didn't think I deserved. And Empire just showed me that I deserved everything that I was getting.
Yes.
And going to my classes, trauma classes, all that stuff, and getting to know who I am, and getting all that stuff that I have on the inside of me out of me, and recognizing who I am and walking around with my head held high. And yes, I have 5 kids, but I only have 1 in my custody. And that's because I decided to live a life that I wanted to live, and now I'm learning how to be a good mother now. Not saying that I'm not a good mother.
You're a great mom.
I'm a wonderful mother.
Yes, you are. Mom.com.
How old's your baby?
She is 7 months.
And the
7
cutest.
months?
She is the
Oh.
cutest.
So beautiful. That's
What's her
my
name?
Worthy.
Worthy?
Yeah.
And that she is.
Yes, she is. Yes,
Her and mom.
she is very. That is really my.
God bless you. And
thank
God bless
you.
Worthy.
Yes, that's my blessing, man. That is really my blessing. She's been there by my side, and I've been there by her side. And
And Worthy has a phone number for our admissions office, correct?
He's really trying to get her.
yeah.
I mean, she's 7 months old now. I'm calculating here, so I'm
Right.
figuring
You know what?
21
And
years,
it would be
5
so
months.
funny
I
if she
want.
was like, yeah, mom.
Right.
I remember
Uh-huh.
watching it.
Right.
So yeah, so I just want to, and one thing that I do know now to give back to my community. So yeah, going to Keeping It Real Ministries and what we do there. Every 4th Sunday, we like to go out and go back into our communities. And I see a lot of people, I'm really well known. So I see a lot of people who that I used to be out there on drugs with and doing substance with and you know, having the time of my life. And they see me now and they just like, I'm so proud of you.
Amen.
How do I come and how do I approach you now? What do I call you now? And I'm Brittany. And that's who I am. And and I have my baby right with me in the carrier, and I'm walking around handing out food, clothes, praying for them, telling them to come in and come get some help, because it's not hard to get sober. It's hard to stay sober.
Yes.
But you have to want to stay sober.
Preach.
It is not easy. I got tired of being tired.
Yes.
I got tired of not being able to have the life that I wanted to have. And now that I am here, I'm making sure that I have a lot of things I got to do with housing, with Health of Southern Nevada. They blessed me tremendously. Empire has blessed me tremendously. I just keep showing up for myself. And that's what you have to do. And I love giving back to the community. I love it. I love helping others. I don't like to hold in. So like, y'all are the doctors. Like I am like,
Supposedly.
you help your patients. I'm helping our community by doing what I like doing, and I give it away. And it's cool because I couldn't give it to them for free.
And you could teach our students that, number 1, and number 2.
Yes.
You're giving so much to the community, but one thing you're forgetting, Worthy,
Yes.
is seeing all of this.
Yes.
In Worthy's heart, this
Yes.
is what life is supposed to be.
Yes.
Look at what you're doing for that young lady.
Yes.
Yeah. I just want my daughter to know that she has an opportunity. And some of us didn't get to have really that opportunity growing up. And
But she's going to see you giving opportunities.
right.
That's
You
what
are
she's gonna
absolutely
see.
right, Joe. Thank you.
All right.
Thank you. Yeah.
Brittany, you hit on, oh my gosh, so many different things. But the one that stuck out to me, and we can attest to this in what we see, is housing. Let's call it housing at large. Look, I have no idea what the solution is, but let me tell you from experience what the solution isn't. Cool, very small. Is we have folks who, let's call it, we think of substance use disorder, aka addiction, as a chronic medical disease. Okay, Brittany. So it's the same as diabetes and high blood pressure.
Yes.
We should be doing all the same things for it. Okay.
Right.
So folks that have an active substance use disorder oftentimes find themselves in a healthcare setting, whether it's an emergency department, an inpatient stay for a few days to what we call detox or whatever, right? Co-occurring mental health issues. From a dollar and cents perspective, because Joe, you mentioned this, a small little inpatient stay, let's call it 3 to 5 days.
If you get that now.
If you get
Right.
it. Well, let's say you do. Let's say you do, okay? That the cost associated with that is the equivalent of me, and because I looked this up, right? I ran the numbers. Here in Las Vegas, an average 2-bedroom apartment for years. Not 2 months, not 4 months, not a year, but years. And that's just one. And we have folks who are consistently having bad outcomes and having to go not to the hospital just once, but numerous times.
Which goes back to why we should go back to the original definition. Even though people are arguing right now academically, should we use the word determinant? Should we use this? The question I ask is, should we use health? Because these determinants also affect your employment, your education. So it affects everything in your life.
It does.
Yeah, social determinants of life.
Of
Existing,
life.
I don't,
Because some social determinants are helpful.
Can I say, I just like to add one thing.
You can say
Of
whatever
course,
you want.
please.
Okay,
It's
so
the floor.
I
You
just
got the
really
floor.
want to know why okay, I hear what you're saying, and I don't like it because it's the truth, and it hurts because when I got into treatment, I know a couple of years ago in West Care, they give you like 8 to 9, almost a year in their
Yes.
program. They help you out. I only got 6 months, like not even 6. I said 6 months, 60 days. And because I had my baby there, I got 90 days, and it was time for me to go.
That's because these are made by people that do numbers, extra rules. So unfortunately, we live in a society that, in all our societies, there's a bottom line to everything. The question is not what is there a bottom line to, but where do we, as a society, want to set our bottom line? We can set it anywhere we want. You know, it was the last time I was in Canada, my driver did nothing but talk about what a great healthcare system they had. England, for the Olympics, started the Olympics program with their health system. Wow. They had like 40,000 beds on the stadium. So, you know, these are systems. Some of them are having problems. We don't have a system in this country. We have 50 different countries. Each country has different systems. Each state has different county, et cetera. I mean, it's a multitude of things. And so the bottom line is that we as physicians work with the individual in front of us.
Yes.
But we also sit there and sit back as Farzad says, what do we do? We're in a position. He's in an incredibly important position in life. Not just because he's an MD, but the positions he carries both at the university and professionally.
Yes.
Why is that so important? Because it not just affects the lives of individuals, it affects the lives of these individuals' families. He's setting up programs that will then multiply and help more families all around the country. So yes, as we go through life, things take different things. You went from taking care of yourself to every fourth Sunday, I got to take care of my community.
I know.
To every single second, I got to take care of Worthy.
Yes.
You know?
She don't play no games.
No, listen, I got a granddaughter.
She's
I've
so
already been
beautiful.
through 2 kids.
Yeah, and I'm glad, Joe, that you mentioned that because for me, like Joe mentioned, I have the person sitting in front of me. Yeah, I can feel like, okay, maybe I have that impact. But what's so cool is, well, one of the limitations is, I mean, that's minimal, right? That's minimal. I can only see so many people face to face in a day, right? But then when those individuals are on their whatever road to recovery or whatever their life of thriving is instead of surviving or resiliency, the impact then starts to grow and grow and grow. And we start to get to that community level where the real stuff is happening. It's not me sitting in an office and talking to you about a medication or how you got to change your community because that ain't going to do it.
Right.
So
Well,
please
it's interesting.
continue.
About 2 weeks ago, I think it's the Center of Thriving or something like that at Harvard. I forgot the name of the institute.
Yes, it's ringing a bell.
Anyways, they came out with a paper said love is what helps society thrive, from both the love of sighted individuals. And, you know, I was reading through that and I said, you know, as far as I know of religious studies, and I'm not a religious studies, my son studied that, but I did not. That's why he became a comedian. But
I'm so not. I'm not.
he is. Okay.
Okay. So I also wanted to touch.
Is that all basic? Western religions are based on love.
It is. It is.
And it's just a very simple concept. It's really not that difficult. Kindness is sort of nice.
It is.
It is.
Just a
It
thought.
doesn't hurt to be kind
That's
to
the golden
somebody.
rule. It
I-
doesn't hurt.
you're
It doesn't
so
cost too
correct
much.
because I'm so tired of people saying they don't say hi. I said, did you say hi?
Right?
Right. Yeah.
Somebody has to initiate it.
It does.
I mean,
It's
I do
true.
it when I go into an elevator. Everybody looks at me like going, this is a very strange person. Do not respond to him.
Right. In the corner, being bashful, you know?
You know, along those lines, Brittany and I we just took part in a group where there's this concept known as half smile.
Oh, yeah.
Where if you just half smile the world, a lot of really cool things will happen back to you. Sort of putting out that. Okay, but I want to make sure I get to one. I have one more question left in the time that we have. Yeah. So you talked about sort of some of the social determinants, and for me, it was housing was a big one. Yeah. But also how housing helped. So it was both sides of the equation. Yeah. How we showed. You mentioned how when not, and then when yes. Yeah. Is there anything that you're facing now? It doesn't have to be now, but was there anything that you're facing that you felt made your recovery challenging, was a huge obstacle, or continues to be?
Okay. When I first moved into my apartment, my food stamps got took. And now I really depend on a lot of, I depend on, I'm a government baby. Hi. And that's just because I'm in a place right now where I'm trying to get back on my feet. And I just moved into my apartment. I didn't have no waters for my daughter. Like, that was like the biggest thing. And I like to eat, you guys. So I didn't have no food. And it was very challenging for me. I really wanted to go back into my old ways because it would have been no problem for me to go do what I used to do to get the food in my house. But I had to, excuse me, I had to sit back and rely on the resources that I had. And they helped me out, and I got to go to a food pantry for the first time in my life, and I've never done that. I was not that girl, you know, even though I see my mom do it. I just honestly didn't know how to really take that, and it hurt me a little bit. But, of course, I got uplifted coming to my groups and stuff, and I didn't have no problem going into a food bank. And actually, the food bank I went into was Just for One project. And one of my friends from actually that was out there doing substance with me, he runs it.
Awesome.
So,
Full circle.
It was just like a real mind blower and an eye opener for me. Like, this really works if I just keep going. It might be a little messed up today. That's today. Tomorrow's going to be even better. And I took it like that. And I had to keep rocking with it. And then I also had, like, all in one day, I had got my keys. I left the shelter, and I was so happy to leave that I left half of my stuff there and did not care. I was like, man, but Empire told me they was going to help me. So I got to my apartment, got the keys, was in there, got my stuff from Empire, and was just ready to go to a meeting, catch a meeting. And then, like, the office called me, and they was like, I'm sorry, help us out. Y'all gonna be mad at me. They didn't pay my my rent. They didn't do the check. So I'm like, what? I already signed the lease. So I was devastated. All this was going on. The food stamps was gone. I didn't have a way I didn't know where I was going to go. Like, literally did not know where I was going to go. I'm like, I kept letting the office property manager know, man, I am a real addict, bro. I really have problems. Like, I really want to go get high. I don't have no time for this.
Yes.
And first thing I called was Empowered. Actually, Amani called me. Okay. And she called me at the perfectest. Oh, matter of fact, I called you. I'm sorry.
You did. I remember that conversation,
and,
Queen.
They walked me through it. They talked. Miss Yvonne got on the phone with me, and we figured it out.
Handled.
She was handing me my keys back,
right?
Because I already signed a lease, and I did not know how. At that moment in time, it was just too much going on for me. But if I just kept on just a little bit of strength that I had and my daughter and having my clothes in my hand and just sitting outside, and I was just like, it's happening. I couldn't believe it's happening to me. And for her to give me, she said, I see you. And we was calling my caseworker back to back. She finally picked up that phone. And I was just like, thank God. She was like, I'll be over in the morning to come bring the check. She said it was because she was not working on that day. So I understand, but I was ready to go on that day. So, fast too. And that right there was a real challenge for me on that day. And I haven't had another day like that. At all.
Let me ask you a question. You are an incredibly optimistic person.
Yes,
Oh,
she
thank you.
is.
You know, with as the waves of these things keep coming at you, your smile gets bigger,
She does.
and
She's
you know,
sunshine.
and you don't go through these things again. What do you think makes you that way? Is
I
it
always
worthy?
had this. Look, I always had this personality. I just never knew how to let it go and let it be free.
Let it
Well, I'm
shine.
glad you let it out.
Yeah, I
because
used
we're
to
really
never
glad to
smile.
see it. You know,
I used to never smile. My friend was like, "Won't you smile once?" And I was so deep in my addiction. I'm like, "Bro, I don't want to smile. Leave me alone."
Right?
And now, I love my smile.
Amen.
yeah,
It's
so do we,
beautiful.
and
I
it
love
makes
my
other
smile.
people happy.
Yes,
Yeah.
it makes us contagious, girl.
Look, thank you. Thank you.
Thank you.
Thank you for sharing. I'm going to have Amani close us out soon, but I just want to point out, look, so you mentioned if you don't have somewhere to live and if you don't have food to eat, it's a challenge.
And
It
it's
really
and
is
not
a
only
real
that, if you
challenge.
don't
Isn't it
have
that
a way to get
Maslow?
to where you live or where the
Right.
food is,
Or where
Right.
the food is, it's a challenge.
Yeah, I've been there. I've been homeless. I know how that, and
Yeah.
especially with a baby, CPS will come in and
And
man,
take
I don't
real
have
quick.
time.
Yeah.
I don't have time to be going backwards. I'm trying to go forward.
Right.
So yeah, that was a real challenge for me. I'm back in high school too, like I
Boom.
said.
Amen,
Like,
queen.
There it
Yeah.
is.
I wanted to say this is why I love Empowered, because just listening to your story, a lot of people, if they were in that situation, because I know when I panic, my brain is hazy. I can't even think straight. Whoop-de-whoop, womp-de-womp. And having somebody that you can call and letting like Miss Yvonne handle that situation for you is amazing. A lot of people do not have places like Empowered to advocate for them, because advocacy is a big part of social determinants,
Big
I
part.
feel like,
Big
of
part.
health. And just the being able, Empowered really helps break those barriers, because I know transportation for me was the biggest issue with my pregnancy with my daughter. I missed a lot of appointments because of transportation.
Right.
And that's something that Empowered, they don't do it for MTM services, but they do provide transportation. So let's say going to DWSS to apply for food stamps and TANF and whatnot. Being able to pay for my birth certificate for myself and for my child so that I can get the food bank stuff.
Right. Okay. They was there for me for the food bank when it came down to I needed to come with a car. I don't have no car.
Right.
But Empowered was there and they filled up the back seat of the Lyft ride, and I enjoyed my Lyft ride all the way back home with the lady. And it was just amazing to actually have that, like, just to know that I have Empowered. If I need them, they're there for me, like, regardless of what's going on.
What was it like to get home, be with Worthy, and put groceries away?
Oh, it was a feeling. Every day I come into my house and it's a feeling that I have never felt in my life. And it's just my stomach has butterflies every time I walk into my home and turn my key, because that's my first ever home, apartment, anything.
I'm a gastroenterologist,
Amen,
but I have
queen.
no butterfly medicine.
Okay,
You have
that's
to live with the
good.
butterflies, all right?
Okay, I'm with that. I'm with it. Yeah, so that's it. It's amazing. I'm so proud of myself. I'm proud.
Congratulations,
Thank you so
queen.
much,
You
man.
doing it.
Every time when I told them I was like, I got my apartment, I had Empire's behind me so strong. I love going there. I love the classes. I love just everything about Empower. It's just teaching me how to be the woman that I am today.
Amen.
And I didn't know none of this before I came into this program. I didn't even know I never let somebody hold my baby. Like,
I remember that.
I didn't, because I have a lot of trauma in just being there. I address all of the things that's going on in my life way better. And all my Miss Rachel, Mac, all of them. Every Miss Queenie, I'm telling you, they advocate for me. They make sure they put me in the right place where I can understand my life. And it's not. And every time I walk into Empower, just Amani, bro, like,
Girl.
she'll make you feel like you are $1 million.
I love you.
So many kind words, Brittany. I realize.
Brittany did it for a girl. Empower did the same thing for me too, which is why I'm able to give back, which is why I can really be there and be like, hey, y'all, let's do this. Because if I can do it and I'm a hot mess, what girl I really
Well,
was.
you know who I hope hears this also? apart from just the general public and people that need help, is our medical students.
Yes.
And our medical students, so that they can realize, as well as our nursing students, our pharmacy students, all of our dental students, that we are in the business of improving people's quality of life, which also means something very important to each and every one of these students. Take care of yourself, you guys.
Yes.
Yeah.
Yes.
Because it could be one of your family members. You never know anything.
Or you.
I honestly, right? It can, or it could be you. Because I done met a few girls in treatment that are actually nurses.
Yeah.
Amen.
Nurses,
And
even the
doctors.
nurses that delivered my baby and stuff, like they tell me their husbands and they was just rooting for me. But it that right there showed me that I had a blind eye. I didn't even know that was going on.
This is a problem that happens to all levels of society throughout the entire history of society. The only thing that is new is the substance that we use. You know, so that's part of human nature. Now the part is, what is the part that harms you, and where's the part where we intervene and say, okay, let's get a good life going.
Right. Like
know?
you said, tired of being tired, because that's where I got to, where I was like,
You know, and
pivot.
You know, because the truth is, it is all about social determinants.
It is.
I mean, even when we make policies, I worked in the both Bush Senior and Clinton administration. So I was there during both health reform and a lot of these other reform issues. But one of the interesting reforms was about drug reform. So the first thing we did in this country, which I think was a big mistake, was mandatory drug sentencing. Okay. Then it doubled down in a very racist way. This was the Clinton administration, was if you're within a certain distance of a church or a school, your sentence is automatically doubled. Now, if you go to the historic West Side or you go to the east part of Vegas, you're going to find a church on every corner. You go to Summerlin, I think the Uber driver has a problem finding the church.
Oh, wow, that's
That
true.
is true, though.
So guess what? If you get busted in Summerlin versus getting busted in these other places, your sentence is doubled.
Oh, wow. I never
Because you're
knew.
always near a church.
So, so because it was near. So,
I never knew.
well, so as we go forward and we look at policies, we have to understand that policies is also a chess game. For every move, there will be a counter move. Okay, but we have one job. He and I took an oath, and that oath is to serve you. And that's what we want to get our profession back to. And one of the things we're doing at Roseman with a program like Empowered, it becomes essential to bring character back to the profession.
Yes.
And if a time that this country needed character and virtues, it'd be yesterday.
Right. Here we go.
We're out of time, Joe. I think that was a great way to conclude. Look, thank you so much both
you were
for
so
being
cool.
here.
No, thank you. You were awesome.
Amani, can you close us out?
Yes. Well, thank you, Brittany. Thank you, Dr. Joe, for today's discussion.
Wait a second, I go Joe. I don't get a title. My name's
okay.
Joe. She's
Joe.
Brittany, I'm Joe. Come on.
Well, thank you, both of you. We really appreciate you guys being here. It's awesome topic. Awesome. I learned so much, and it put a lot of things in perspective for me. But to our audience, thank you so much for listening or watching this episode of Empowered Voices. We invite you to share it with others who may find the topic interesting or helpful. Be sure to subscribe wherever you get your podcasts, as another episode drops in 2 weeks. We also encourage you to visit our website, empoweredmoms.org/podcast, to share your thoughts on this episode or suggest topics you'd like to hear more about. Thank you.
And
Thank you.
And also for Empowered, if you're moms out there and you have new clothes or extra clothes or a stroller or anything at all, donate it. We need it. Okay? And these are really good kids because they got unbelievable moms.
Right.
Thank you both.
Thank you.
Thank you.
If you live in Southern Nevada or in Reno, Carson City, Churchill County, or Lyon County in Northern Nevada, or in Weber County or Davis County in Utah, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance required. Visit empoweredmoms.org for information or to request services. If you live outside of these areas, we encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrea Peterson and Jason Roth, with production assistance by Rachel Mack. Recorded at the Video Podcast Studio in Las Vegas, Nevada. For information about this podcast and past and future episodes, visit empoweredmoms.org.